The latest trend in the world of wellness involves taping your mouth shut while you sleep. Seriously, just ask TikTok. And it is especially popular right here in Colorado. According to a study we got this morning, which says Colorado is #2 in the US for mouth tape for sleep searches.
So we had to ask. Our medical expert, Dr. Paul Coley, is here to talk about the trend. So I see this all over the TikTok. Like, people are really doing this, and like, people believe in it. Do they have any idea what they're talking about?
It's a hashtag, 373 million views. And in fact, I have patients every single day who are doing this, who are asking me about it. And the idea here is not to put some kind of duct tape or strong tape, but more of a porous, breathable tape over your mouth to really force what we call nose breathing or nasal breathing. So it doesn't help you fall asleep faster, but the influencers are saying that it helps you sleep better and it's better for your health.
So you tape your mouth, you go to bed, and then you're supposed to
breathe through your nose, because if your mouth is taped, how else is the oxygen in the air going to get in? So it's a way to sort of train or condition your brain to sort of breathe through your nose. Now, why would you want to breathe through your nose? Well, there are a lot of health benefits to that, actually. People who are mouth breathers have more bad breath, they have more gum disease or gingivitis, they actually have worse quality sleep. The people who breathe through their nose, they have more nitric oxide, which is a chemical that's good for us. They oxygenate their blood better. And in fact, our nose has tiny little hairs that filter all the air and put humidity into it, so that your lungs are happier receiving nose air than they are receiving mouth air. So the idea is to sort of force yourself to breathe through your nose by closing off your mouth.
Well, those are all very positive things. So do you recommend it?
Absolutely not.
Oh,
in fact, the medical community is really hard on this. There is no scientific evidence to suggest it's beneficial. In fact, there's evidence to suggest it may be harmful. And so I really hope that this trend starts to die down, because it's the young people mostly that are doing it. 12% of people have said they've tried it within the last 30 days, according to the American Academy of Sleep Medicine. And so think about what you're doing. Two things have to happen. Air has to get in. So if you close your mouth, and let's say you're a little congested, you have a little allergies, you're sort of choking yourself, asphyxia, while you sleep, because you're basically kind of, it's like putting a pillow over your mouth. So air could have trouble getting in. That's one. Number two, let's say for some reason something needs to get out. You wake up vomiting and you've taped your mouth shut. All that vomit is going to go into your lungs and things are going to have trouble getting out. So this is absolutely not a trend I recommend to anyone. There's no benefit whatsoever. If you have concerns about it, there are other things you can do. You can talk to your doctor, but don't tape your mouth.
So what are some alternatives to mouth
So
taping?
one that I think is good is to use the nasal strips. So what those do is they actually tend to open your nostrils. So they open the hole of the nose, and that allows air to get in. Sleep on 2 pillows or sleep on your side. These are both ways in which you can also sort of support more nasal breathing. And then really good sleep hygiene, which I know none of us want to hear, but having devices before bed actually makes us sleep worse, including more mouth sleeping. And then if that's not enough, you can actually go to physical therapy, and it's called orofacial exercises. You have exercises that you can do with your jaw. You could even wear an external device that kind of opens your jaw up, or wear a dental appliance if you talk to your dentist. But these are things obviously you'll have to talk to a professional about. But there's lots of great ways to get good sleep, and I highly encourage nose breathing. In fact, even during the day, guys, as we're sitting here, whenever you're feeling stressed or whenever it's always your nose.
You're right.
You close your mouth and take a nice deep breath through your nose, and it does really wonders for our body. So the more that we can train ourselves while we're awake to breathe through our nose, the more we're likely to do it at night as well.
Are you a mouth
Did it
breather?
work?
I don't think so, but I don't know.
You sleep like a pretty princess.
Maybe
right?
we should ask your husband.
I will. I don't know. I never thought about that.
I don't know either.
I get terrible sleep, but I think it's for,
But so snoring is a sign of mouth breathing.
Okay.
And you
Do you
basically,
snore? I don't think I snore, but my husband does.
so you basically should talk to your doctor if you snore, if you're tired during the day, if you're really having chronic problems with sleep, or if you're nasally congested chronically, like with allergies, you need to go see an allergist. Maybe you could try those nasal rinses, but it's important to clear out your nose so that you really can encourage your body to breathe the way it was designed to breathe.
Right. Dr. Coley, thank you.
And we'll check back with your husbands next time.
Okay, for the full report.